Hello everyone and welcome to today's workshop on opioid crisis in Oregon, organized and coordinated by Opioid Task Force Oregon with the State Opioid Collaboration. We are going to look into a few things today, and first is implementation of opioid prevention and treatment initiative, which is conducted today, August 14, 2021, and the presenter is Orpa Uma, MD, Senior Health Director. Overview: in 2018, Oregon providers wrote 57.3 opioid prescriptions for every 100 persons in 2018, compared to the average U.S. rate of 51.4 prescriptions. This is the lowest rate in the state since 2006, when data became available. In Oregon, drug overdose deaths involved opioid total 339 in 2018 and have remained level since 2012. Deaths involving prescription opioid or heroin remain steady with the respective 151 in 2000 and 154 in 2018. Deaths involving synthetic opioids rather than methadone, mainly fentanyl and fentanyl analogs, trended up to 97 in 2018, more than twice the 43 deaths reported in 2016. This figure shows the number of drugs and opioid-involved overdose deaths in Oregon by opioid category. Drug categories presented are not mutually exclusive, and deaths may have involved more than one substance. Source is CDC Wonder 2020. Work groups have convened and projects are underway, all aimed at reducing opioid misuse and overdose. These significant steps forward include approval of statewide prescribing guidelines by a work group of statewide providers, chronic use opioid reduction strategies with the CCO statewide performance improvement project, naloxone availability, increase in medication-assisted treatment, coverage of non-opioid therapies for pain and prescribing limitation policies, community intervention in high-burden regions, and ongoing surveillance of controlled substance prescribing and drug overdose outcomes. A data dashboard is available with state and county statistics for opioid-related health outcomes and prescribing metrics. Primary goal is to reduce risk to patients by making pain treatment safer and more effective, emphasizing non-opioid and non-pharmaceutical pharmacological treatment, reduce harms to people taking opioid, and support recovery from substance use disorder by making naloxone rescue and medication-assisted treatment, also known as MAT, more accessible and affordable. Protect the community by reducing the number of pills in circulation through the implementation of safe opioid prescribing, storage, and disposal practices. Optimize outcome by making state and local data available for monitoring, evaluating, and informing policies and targeted interventions. Improve access to med services for patients through the state, educate partners and stakeholders on the value of increased med utilization, and partnering on innovative ways to serve Oregon's opioid-dependent population and increase the number of profile-waived physicians in practice in Oregon. The educational objectives is by the end of this learning session, participants will be able to learn strategies to reduce problematic prescribing, use opioid prescribing guidelines for pain management and in emergency departments, use the Oregon Prescription Drug Monitoring Program to assess and manage patient prescription, provide coverage for non-opioid chronic non-cancer pain treatment therapies, increase the number of providers who are certified to provide medication-assisted treatment services in conjunction with local substance use treatment programs. Um, Evaluate risk of addiction. Estimated that 2.1 million people in the U.S. are addicted to prescription opioids, and this number is rapidly rising. Risk of addiction to opioids is higher if family and personal history of substance abuse. Age is a factor too. 16 to 45 are the most at risk. History of pre-adolescent sexual abuse and psychological diseases. Addiction risk. Long-term opioid therapy is associated with little risk for addiction when given to selected patients with chronic non-conscious pain and no history of substance addiction or abuse. However, recent studies show continued rates of opioid use. A study found that 10% of people who were prescribed opioids within 7 days after a low-pain surgical procedures were still using them a year later. A study also found that 6% of the patients continue their post-operative opioid prescription for more than 150 days after surgery, and about a quarter of patients having total hip or knee arthroplasty were still taking opioids 2 years later. Opioid tool risk, length and time, 5 attempts, less than 1 minute to administer and score. Assess risk of aberrant behavior when patients are prescribed opioids for chronic pain. Provide excellent discrimination between high-risk and low-risk patients. Patient categorized as high risk on the ORT have an increased likelihood of future abuse and drug-related behavior. I've attached a link here where you can learn more about opioid risk tool. And method to use for this presentation will be its workshop presentation in the dissemination of scholarly use of team-based learning in the preclinical medical school courses and written material. There will also be we will also use interactive methods or hands-on. There'll be questionnaires and there'll be group discussions, and we'll also use materials from CDC and government websites. Addressing opioid epidemic involves many local, states, and national partners. In Oregon, our opioid initiative partnership includes the following groups. In Oregon, we have coordinated care organizations, emergency departments, Life for Life, local public health departments, opioid treatment program in Oregon, Oregon chapter of the American College of Emergency Physicians, Oregon Health Leadership Council, Oregon High Intensity Drug Trafficking Areas Program, Oregon Pain Management Commission, Pain Management Clinics, and Public Safety. National partners are Center of Disease Control and Prevention, CDC, and Substance Abuse and Mental Health Services Administration. Thank you so much for participating in this workshop, and we'll look forward to hearing back the feedback on what we can improve and what we can do together. Remember, everyone can get addicted to opioid. Learn more about opioid and protect yourself. Thank you.